Hi, my name is Trent Sobiek and I am a student physical therapist. Today I will be demonstrating the gamekeeper's thumb stress test. This is also known as the skier's thumb stress test and the ulnar collateral ligament valgus stress test. We'll be assessing the instability of the thumb and the ulnar collateral ligament along the ulnar side of the first ray. This ligament resides in between the metacarpal and the proximal phalanx of the first ray at the MCP joint. The instability of this joint occurs with such mechanisms of injury as a fouche, where the hand and thumb is abducted away from the rest of the hand and causes a valgus force at the MCP. This is why it's called a skier's thumb. When a person is holding on to a ski pole and they fall with their arm out, the ski pole and the thumb get pulled behind. The loose pack position of this joint is slight flexion, and the closed pack position is pure extension. The Heyman, 1993, did the sensitivity and specificity of this test. He found out that the sensitivity was 94% when you did the test, but when you felt a palpable mass along the distal carpal or metacarpal of the first ray, where the ligament actually would be torn off, that sensitivity increases to 100% and the specificity increases to 46%. This is saying that if you feel a palpable mass and have a positive valgus stress of greater than 30 degrees or greater than 15 degrees compared to the contralateral limb, that you are 100% confident that they have a tear of this ligament. I will now demonstrate this on a patient, and on this hand, the ulnar collateral ligament is positioned right here. So to create a valgus stress on this tissue, I will use one hand to stabilize the metacarpal with my right hand, and with my left hand I will grab the proximal phalanx. During this test, I will get my fingers close to the joint line, and when stabilizing the metacarpal, I will provide a valgus stress to the proximal phalanx. Again, if there's greater than a 30-degree laxity or instability, I should say, within that joint, that is a positive test. So I will now describe this in layman's terms. Devin, you recently had an injury to your thumb.
Yes.
I want to assess the integrity of your thumb. So what I'm going to do is I'm going to press in a direction like this to assess the ligament that holds that joint stable. So you come in here, stabilize the proximal phalanx or the metacarpal, and then provide a valgus stress on the MCP joint. The patient is in the seated position with the forearm fully supported by the table, so that the only motion is coming at the MCP. This was the valgus stress test of the ulnar collateral ligament of the first ray. This is also known as a gamekeeper's or skier's thumb stress test.